Ladies and gentlemen, please welcome Lifesten Health. Lifesten Health develops incentive-based health and wellness programs to help people adopt health behaviors and improve their lifestyles. One more time, give them a round of applause, ladies and gentlemen, as they walk towards their pitching point.
Greetings, everyone. My name is Peace Ndori Iraguha. I co-founded Lifesten Health, which is a medtech company based in Kigali, Rwanda. And at Lifesten, we reward you for being healthy. So before I get into what we do, let me take you through why we do it. So imagine a world where you have no idea about your health status. That's the world Asha was in when we met at the peak of the pandemic in 2020. I was working as a nutritionist, and she was struggling with high blood pressure and overweight. I made it my personal goal to help Asha prevent herself from developing hypertension in the near future. You might wonder why I took it upon myself and make her case personal. This is because Asha was one of the very few, if not the only one, of the preventative cases I've ever encountered in my career. Everyone else comes in when they're already sick, and the only help possible is medication. I was able to do that, and Asha's story resembles many of other young people in Africa. So what's the problem here? Tech team. So moving to the problem the Lifesten is targeting, we're targeting the rising burden of non-communicable diseases. To those in the room who have no idea what non-communicable diseases are, these are diseases that can be transferred from one person to another. The examples include diabetes, hypertension, and the likes. So the problem here is that first, there is lack of awareness when it comes to these problems. The current health system mainly focuses on the curative measurements, people who are already sick, and leaves out the preventative side. There is also the rising, unhealthy habits, as it was seen during the pandemic, more sedentary living, especially in young people. We also have fragmented access when it comes to diagnostics for these services. This brings us to the biggest challenge we have in the public health sector today. First, 1 out of 3 people in sub-Saharan Africa are at a risk of developing these diseases. And currently in Rwanda, 55% of all hospital admissions are related to these diseases. To top off all that, 6 out of 10 of all mortalities in Rwanda, Kenya, and other countries in Africa are also related to NCDs. So what's Lifesten doing about this? First, we're bringing a solution where we give people control over their health. And how we do this is first availing diagnostics. So at the moment, how it's usually done, you use, for example, for hypertension, a blood pressure kit, put in the data into the system, and then it gives you recommendations of what to do. But we're partnering with a company called Biospecto that allows people to remotely diagnose and monitor blood pressure. We've also integrated our solution with popular wearables like Apple Watch, Samsung Watch, Fitbit, and the likes. On the other hand, we develop incentive-based programs which are challenges around nutritional health, physical health, and mental health. These are the 3 main pillars when you come to the preventative care of NCDs. So you can choose to do these challenges solo, but you also have an option to create or join a community. The community can be people you work with, your friends, family, etc. For every activity you do on the platform, you collect points. And these points are called life coins, and they actually mean something. They can be redeemed for actual rewards, like free passes or discounts for gym subscriptions, massages, spa, or any other interesting thing to mostly young people. So who are we targeting with this solution? First, we have Asha, who I introduced to earlier, who represents people who are at the risk of developing these diseases. And then you have Kenti presenting people who are already suffering from these diseases. Then you have corporates seeking to have a more productive environment. What value do we bring? First, for Asha, we make health tracking easier. We also reward her for every step she takes towards being healthy, while also giving her textualized information. And for Kenti, we have remote screening, and we also allow her to join accountability groups. For corporates, we bring in data to make more informed decisions in the future. So our go-to-market is very simple. It's mostly around distribution, marketing, and partnerships, where we're targeting with key players in the market to bring these services on the market. Our business model is simple. It's subscription-based. First, you have a freemium model where users can interact with the platform. And then we have B2C, where users pay for specific personalized programs. We also have B2B for businesses to pay for the Lifesten workplace programs. Our projections in the next few years, we're looking to subscribe 10,000 premium users and onboard 35 plus workplaces, and also 45 wellness and health partners. The competition is there, and one of the biggest is Discovery South Africa, which is a $1 billion company, and that serves to prove that there is potential in the market and the problem is huge. I'm not doing this by myself, and this is why we've been able to launch our MVP version 1.0. We've used it to collect data, and we currently have 120 plus beta testers and a wait list of 15,000 plus and growing. We've been able to raise 25,000 USD and signed 6 of the biggest health and wellness partners. We'll be launching version 2.0 before this year ends. This is the team behind Lifesten, myself and my co-founder Stephen Ogweno, our product manager and developers. So let's not forget, we're raising 150,000 USD, and 40% of these will be going into product management. The rest will be split around clients acquisition, partners onboarding, and HR. Join us at Lifesten, where we're changing mindsets from I think I'm healthy to I know for sure that I'm healthy. Thank you.
Thank you, Peace. I think I'm healthy. I know I'm healthy. What do you say about it, Eric? Are you healthy?
I think it's a very, very impressive pitch. I think it is an impressive company. What do you think you will need the most to succeed?
First, it's talent. We need, it's at this stage as a startup, it's very easy to get the type of talent you need to develop this kind of solution. And the other thing is that to bring this solution to life, this is something that takes time. There is no data around non-communicable diseases, and this delays the launch of the solution, because you have to find the data fast and build on the top of the data. So this takes time, and sometimes there will be back and forth as we try to really understand what the customer needs.
So actually, I have a question for you about the data, actually. Do you have specific elements in place to protect the information of people?
Yes,
we do. Let's say I'm using your service. How do I make sure my data remains private?
Okay, yes, we do. So we follow strict laws that goes in line with GDPR and also the regulations in the area. But for the data we collect are anonymized, and the user gets access to the information and are allowed to delete the data whenever they don't feel like continuing with Lifesten. On the other hand, we have partners who are already health and wellness partners in the sector who have the agreements to collect this type of data. So the data that will be protected goes to these partners who already have permission to collect this type of data if it's too medical for Lifesten.
Yes, Hortense?
Yes, thank you. Mine is just more to have a basic understanding of the solution, because I see there's, you mentioned remote diagnostics, and I saw that there was mention of wearables and the diagnostic. Can you explain just a bit more about it and who your target market is precisely in terms of, because when you started out the discussion, it was with Asha, and my initial thought was that, okay, probably this is someone who is not currently in the city center, but it's just more to understand who the market is and more so about the solution and how someone will use it.
Thank you. Let me start with who we're targeting and the solution we bring to them. We're targeting young people who are indulging more and more into risk factors associated to non-communicable diseases. These are things like drinking, unhealthy eating, physical inactivity, smoking, and the likes. And this goes up every year, and those are our main focus. People who think they're healthy because you're young and your body can deal with whatever you're bringing in at the moment. That's who we're targeting. That's our primary focus. And that's why our solution is focusing on making healthy fun and cool, which is very different from what we currently have in the market. So how we do this is gamifying health and rewarding people for every step they take, because we acknowledge that behavior change is not very easy and it takes time, and as they say, it takes a community. So the solution is around, first, we want to increase diagnostics. We have people in the room who have never checked their blood pressure since they were born, or it's only checked when they visit the hospitals. That's not how it should be done. So we are partnering with this Swiss company that has a technology to remotely screen blood pressure. It uses the same technology as the ones in smartwatches. And with the integrations, we acknowledge that there are some people in the market who use, let's say, Apple Watch to track their steps, calories, etc., sleeping hours. So for those ones who already have that, we're just making sense and tracking progress for you. But this is not another smartwatch. Instead, we integrate that data, bring it into the platform without you logging in or bringing in that data manually. So the data on your Apple Watch will be automatically taken to the platform. And then the platform will make sense of the data and then give you recommendations based on your data from your smartwatch or etc. So for people who don't have access to those smartwatches, etc., it's able to do that. It has the built-in capacity, maybe not as accurate as people with smartwatches, but then what it gets to do is that you get to set goals, small goals. Let's say drinking a cup of water a day, if I'm struggling with that. And for every challenge I do, okay, 1 second. For every challenge I do, I gain points. So the points incentivizes me to go higher and do better in the next few days.
I want to ask you another question regarding the target market. Have you done any research or study? What percentage of the market can afford buying such a subscription?
Okay, thank you. So as I mentioned, our target market is young people, and these young people who are indulging in sedentary living actually have access to smartphones. They're the highest technology users we have. So that's why, but not everyone can afford the solution. So we have a freemium model which has the basic features, and we believe this will create the need around now going to the next level, personalizing that to yourself. So when you create the need, now you can afford to pay. So the fee is around $3 USD to $5 USD. and you want it to be specific. Are you struggling with mental health? Then you pay for those specific features. Is it physical health? So that it's personalized to you.
One more question. Have you considered having a business model with your partners, the organization that you want to partner with?
Yes, we did. So in the future, currently we have development partners. And how that works is that they offer rewards to our users, free passes or discounts. But later we're looking to onboard now third-party partners who pay a listing fee to be on the platform and then in their services so that users can go directly to them.
Yes, peace. Your patience, your passion of keeping us healthy is really impressive. Keep it up. Thank you.
Let's give it up one more time for Lifesten Health. A round of applause.